The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Welcome to the Mind, Body, Spirit Show. Rudy Show. I have a guest with me today, Elon, and he wants to learn about kidney stones, which is our main subject. He's never had one. Welcome, Elon. Hi, Dr. Kachmann. I just want to know about kidney stones because I don't ever want one. Okay, they are actually quite common. About 30% of the people have at least one stone in their lifetime, and if they've had one, they'll get another one. I don't want one, Dr. Kachmann. Okay. Hello, folks. Hello, folks. And the kidneys are related to heart disease, too. That if you got heart disease, odds are you get kidney disease. And the kidneys, we have two kidneys. They're about the size of your hand, and if you have pain in them, they're sort of in the low back area. And the best way to, when you get your routine blood screening, be sure to get your GFR, glomerular filtration rate. I notice a lot of people, I ask them for the results of their blood and urine test, and I noticed that they haven't had that GFR, but which is, you know, when you're about a teenager, normally, although some kids now already have kidney disease, the amount of fluid going through your kidneys, about 100 normally, but here I am, age 39 for the 48th time, and my GFR is 80. That's really good, Dr. Kachmann. I'm really impressed, so 80 at my age is okay. But once you hit 35 or so, they begin to talk about dialyzing your kidney, and you got to go to a center or do it at home. And 2 or 3 years later, a lot of people are not alive anymore. So have good kidney function is important. But let's hear more about. So we have two kidneys, and then they get drained by ureters, go the bladder, and then in men, below that is the prostate, and then the urethra, and then you urinate. But we need to produce a certain amount of urine every day because the kidneys clear food out of our body that's been metabolized. But incidentally, people with type 2 diabetes, which 80 or 90% of the people have got, and after this I'll do a half-hour show and tell you how to get rid of diabetes. You can teach me how to get rid of diabetes? Yes, I can. Oh, that makes me so happy because a lot of people in my family have it. Wow. Okay. When you have a kidney stone, people can have belly pain. They can have pain in the groin. If a stone is blocking the flow of urine, then you can have unbearable pain in your back, either side, depending which kidney is the worst. Usually it's one side or the other, and as they say, it's the worst pain there is. I believe it because I've had a few in the last 15 years. But they are largely avoidable. And that's what I'm going to teach you today. Very important. 80% of the stones, which can be the size to the point you can't see them, they're only chemically in the urine. You check the urine and they're full of oxalates. So oxalates are crystals, and they are 80% of the stones, but they can be the size of a ping pong ball that you pass. Yes, they actually, the whole kidney can be a stone. They can get that big, yes. And the biggest way to prevent it, we'll bring that right out up front here, is drink a lot of water. That's why I even have water here today. I play tennis all the time. I play tennis all over the world. I never drank the right amount of water, and the reason being was it would just sit in my stomach and I could hear it splashing when I played, but that was a mistake. The other day I was playing pickleball, which I play. You play pickleball, Dr. Kachmann? Yes, I do, regularly. At Ace's, the place, a new place in town, 21 courts. They're having a celebration tonight, and I'm going to it. Can I go with you, Dr. Kachmann? Yes, you can, Elon. And so drinking fluid is the best way to prevent it. For some reason, no one really ever taught it to me, or as a doctor, you would think I would know better. Maybe I didn't have them often enough to think a lot about it, but I now, you can read a lot about it, the science of it, which I encourage you to do if you have had a kidney stone, or have had some symptoms of it at least. My latest episode, I had some bloody urine, felt frequency like I had to go, a little blood clot, but I did not really have a stone, so thank God. Gather the information. Find a nurse practitioner or a doctor and look on the internet. Read a book. This is an excellent book here that discusses it thoroughly. No More Kidney Stones by John Rodman and Ernest Sosa. I've read the whole thing now a number of times. So you need to gather information. Just drink a lot of water, although that's the most important thing, generally will not solve the problem. You need to know, because it's motivating once you need to know. Okay? So and there are many other books, but that is the best of the books. And so 80% of the stones that we have, or if the chemicals are increased in urine, that alone can cause you belly pain, but maybe no bad back pain, or where it has to be addressed, maybe even with surgery or instruments or whatever. So oxalate stones, oxalates are made by plants, okay, and by humans, and you can read some books or some papers and say, just cut out, learn what are oxalate foods, vegetables. Don't worry about the meat. That's wrong, because we also have uric acid stones. They represent 10-15% or so, and they are from purines, uric acid, and are related to eating a lot of meat. It's the amount of meat, and I'll discuss that with you. So also salt will more likely, so look at the salt content. We need a certain amount of salt, 2,500 milligrams or so a day, so you can't cut out salt completely, but adding salt to foods, you're more likely to form stones. And these stones, and there are about many different types, but 90% are oxalates, a chemical, okay, made by plants, but humans make it too. they're beginning to see, and the research is constantly changing, they're beginning to see that there are some oxalates almost in all things, but it is much more important to stay hydrated, drink water so that chemicals get diluted, they don't form stones, and to watch the amount of meat that you consume. You don't have to consume zero, but watch the amounts. So these stones can be very small to a few inches, but like I said, they can take over the entire kidney, but the ones you pass are generally a ping pong or less. And the main reason they cause pain because the stones interfere with the drainage of the urine, and then the urine backs up, the kidneys get enlarged, the ureter gets enlarged, and that's what's causing the pain. So hydration is critical, and like I said, the oxalates turn into crystals that if you look under a microscope, they would look like a dumbbell or an envelope. Like that's the shape that they are, and they're clear, but these crystals scrape the ureter and can cause bleeding. And the pain, like I said, can be unbelievable. I'm sorry, Dr. Kachmann, that you had these pains, but yes, I have had it. And they can even attack your GI tract and your heart rate. I've had it happen. But now that I'm drinking a lot more water, I haven't had it anymore. The other thing to do is to get some calcium into your body, because the calcium binds with oxalates that your body makes so that you're eating, and it goes out in the stool instead of going to the kidneys and causing you all this trouble. So that's a good one. And to get a little more calcium in your diet so that it combines with oxalates and it leaves in the stool would be to drink a little bit of milk, or I think yogurt's a good one. I now eat yogurt every day, pure yogurt, nothing added to it. It tastes good, and I haven't had a problem with passing a stone since that time. So again, stones, symptoms they can cause just belly pain, frank pain, nausea, vomiting, but unbelievable, frankly, amount of pain. And so back pain, abdomen, groin pain, unbearable pain. And there are people who have some very small stones and they have no pain at all. But frequent nausea, vomiting, painful urination, the need to go all the time, these are common symptoms of a stone problem. And so it can be unbearable, as I already mentioned. So if you follow a kidney stone diet, which I'll tell you about, and it just make sure you're consuming enough fluid, avoid certain foods which have oxalates in them. Remember, your body makes them. Your body makes more than you eat most of the time. But what can be symptoms? Urine can be cloudy. It can be bloody, smelly. If you're smelling your urine much more, you wonder about a stone that you're forming stones, or your oxalate level is up, or your uric acid, remember the two most common stones, is up. And again, 15 years I've had this intermittently. I remember going out of town to a medical convention, and I ate a Brazil nut because years ago I was, reading a lot about nuts. It can prevent heart disease. Well, eating nuts, it will form kidney disease. Kidney disease, Dr. Kachmann? Yeah, kidney disease. And so eating nuts, not a good idea. Wow, I didn't know that, Dr. Kachmann. Thank you for telling me about it. So what can help prevent them? I mean, if you can't, if you're changing your diet, drinking more water, getting more calcium in, like through yogurt, cheese, milk is not working, they may try drugs on you, okay? And but like I said, the vegetables are the ones that make oxalate, but so does your body. Then I begin to discover that maybe your body makes more oxalates than the vegetables that you eat. One can, you can go online and get a whole list of the oxalate content of the food. So not eating nuts, which are high oxalate, for example. Chocolate is high oxalate. I don't eat chocolate anymore. I mean, that's just the way it is. Coffee is okay. So vegetables do have oxalates, but certain vegetables have less. Beets have a lot of oxalates in them. So the list is constantly changing, and there's some confusion. One thing I was reading online, University of Chicago, I can't believe it, and they were saying, eat all the meat you want, don't worry about stones. That's wrong, because meat makes uric acid, and if you're eating a lot of meat, you can form a uric acid stone. I did recently. Normally, I eat 2 meals a day. That's just the way I am. That works fine with me. I stopped at a restaurant and ate a pretty good piece of meat, which I like. Some chicken, also had some sauce with it, and I took half home, ate half. Well, I think that'll probably equal the amount, but that night I went to a function and ate another big piece of meat, and guess what that night? I had terrible belly pain, flank pain, had blood in the urine. Yes. And then it passed quickly into the urine. 2 hours later, looked fine because I drank a lot of water. So I must have gotten really high oxalates that day and high purine because I ate a lot of meat. Meat does form stones. And the statement which I read from the University of Chicago, that oxalates are only made by plants, eat all the meat you want, is wrong. It's the amount. I didn't say no meat. It's just the amount that you eat. You mean I have to watch the amount of meat you eat? Yes, you do, Leon. You just can't eat all the meat that you want because oxalates on plants. I'll eat all the meat I want. Wrong, Elon. That's wrong. I try to be better about that, Dr. Kachmann. And but again, the science is constantly changing, and you must, and some of the science being promoted by certain universities or businesses are orientated to money they're receiving from industry. And it's very hard to know the extent of that. I couldn't believe a university would not give you the correct information, but it's there on the internet. I read it. So let's go across certain foods and which have a lot of oxalates in them. One that's full, spinach, very bad. I can't eat spinach anymore. I can't eat spinach anymore. That's right. That's full of oxalates. I wouldn't eat spinach. Potatoes. That's instant. And there's some controversy about that. You get a look on the internet and see that the latest which I read, I didn't say that was necessarily updated by anybody. So keep on looking. Boiled potatoes seem to be okay, but a baked potato is full of oxalates. I love baked potatoes, but I think I'm going to have to give them up, although boiled potato is okay. But you check the science and see that's correct. Yogurt is a good idea. Remember, I recommend that because yogurt, milk products help prevent they combine with oxalates that are in your bowel, which you may have eaten, be passed out in the stool instead of the kidney, and you don't have a stone. So I eat yogurt now every day, and I've had no problem since. Drinking a lot of fluid, eating some yogurt and cheese for my breakfast, lunch, and I've had no trouble since that time. And milk is okay. So make a list. Know what are good foods and bad foods. So a combination of yogurt, low oxalate foods, and avoiding the amount of meat that you're eating may do the trick for you. I think it's doing it for me. I think it's done it for me. So meat is okay to eat, but you got to watch the amount. Okay, remember what citric acid stones, nitrates, you can have kidney stones. So chicken, steak, fish, the amount is what counts. The amount that you're eating. So portion control is important. So citrus fruits, lemon, oranges, help prevent grapefruit seem to help prevent stones, okay? And remember what I said about dairy, milk, cheese, yogurt are preventative. That's well in the literature, and I think it's working with me. Salmon fish is rich in vitamin D, which helps prevents. So the reason it works because there's a better absorption of calcium. Foods to avoid: salt. Remember I mentioned that because they increase the calcium in the urine, not in the urine. Okay. Animal protein. Remember I talked about uric acid. So it's the amount that counts. Bad vegetables are spinach, beets, chard, and carrots. It's the amount. You have a little bit of a carrot, it's okay. Big tomatoes can be bad, but you eat just a slice. It's the amount that counts. So bad sodas, the biggest cause of diabetes, drinking soda pops. Diabetes has associated with kidney stones, okay? So Coca-Cola, Pepsi are high in fructose, synthetic sugars, and phosphate, which increase stones. Water. It's not drinking more Coke or Pepsi, it's drinking more water, okay? Coffee is okay. I would consume, the average person ought to consume about 8 to 12 glasses of water, or like I do, about 3 20-ounce bottles. And coffee may be positive. It doesn't seem to affect kidney stones very much, but you may urinate a little more, but I think you're keeping in more fluid than you're excreting. So look at the color of your urine, okay? If it's okay, it's watery, a light yellow. It should be light. Dark yellow means you're dehydrated. You need to drink more water. I promise I'll drink more water. Okay, Elon. I don't want you to ever have a kidney stone. Thank you, Dr. K. And so how do you diagnose them? You can by looking at the urine itself through the microscope and see what kind of crystals they are. Remember, they have a certain shape, the oxalates, like a dumbbell or an envelope. So X-ray, CT, MRI, ultrasound, also helpful. A 24-hour urine collection is a good one, because even without having evidence of a stone, they can see what kind of crystals are dominating your urine. It's normal to have some uric acid chemicals, some oxalate chemicals in the urine. It's the amount that counts. So what other things are helpful? You can use basil juices. Ethanoic acid is in there, breaks down kidney stones. It's an antioxidant, anti-inflammatory. So that's good. Apple vinegar disables kidney stones. Okay. The acidity of the urine, whether it's alkaline or acid, is important. We have acid and alkaline urine or blood. Okay, 7 is below 7 is acidic. Higher than 7 is alkalinic. We want alkaline urine is what we're after, so that's a test you can get on the urine and see. And treatments can be medication, alpha blockers, lithotripsy, where they send shock waves to the stone if you see them. When I was having my trouble recently, I had a KUB. Oxalate stones are radiolucent. On the KUB, you would see them. They didn't see any on my KUB, and I wondered if maybe it's just I have an elevated acylic acid and no stones. Well, that'd be fine and easier to correct. Then again, they could be uric acid, eating too much protein. Remember what I ate that day? I ate a lot of meat and had a stone. Maybe I have uric acid stones. I still don't know. You should try to find out, and a 24-hour collection may tell you what type of stone that you have. So, Dr. Kachmann, you don't know what type of stone you have. That's right, Elon. Well, you better get that 24-hour urine test. Well, that's exactly what's coming in the mail to me from my provider to collect 24 hours of urine. I want to know the type of stone I have, but the corrective action for uric acid or oxalate stones is really almost the same. Although eating less meat, if you have a uric acid stone, would be a good idea. So you can take care of a stone. Remember I said, so lithotripsy, you send a shock wave, break them up. You can put a scope in the bladder and break them up. And that, there's a little bit more to that. So what are high oxalate foods? You're going to tell me what a high oxalate food? Yes, Elon. That'll help you what foods to avoid. Remember, that's part of the answer, type of food. It's more to that. Remember, your body makes oxalates too, but type of food. So what are high oxalate foods? Beets, berries, black pepper, celery, chocolate, cocoa, collards, dark beer, eggplants, figs, nuts. That's a big one. Don't eat nuts if you have kidney stones. They're full of oxalates, more likely to have a stone. So nuts, really, chocolate and nuts, don't bother. Parsley, purple grapes. Yeah, I like grapes sort of as a snack here and there, but green ones seem to be okay, and I like green grapes and find I seem to be fine with them. So, and I love green grapes. I love green grapes, Elon says. Okay. And so tea is also bad. Coffee is fine, but tea is fine. Coffee is okay. Soy products are bad. Spinach, remember I mentioned already, is bad. Swiss chard, tangerine, they're full of oxalates. What are low oxalate foods? Remember, you can get a list, and the list from the University of Chicago, although I don't like their advice about eating meat, they have very nice lists that you can print out and review it periodically. And low oxalate foods are apples, juices, which I mentioned, cabbage, cauliflower. That's a good substitute for potatoes, for example. And again, I don't think I know the final word about potatoes yet. Whether if you boil them, they're better, and if you bake them and eat them, that's bad. See if you can find out. Let me know. I'll let you. You let me know, Dr. Kachmann. Yes, Elon, I will let you know. And but I love potatoes too. Okay. And now, what about bread? I mean, it's full of sugar, oxalates. but cornbread is good. That's the bread I would eat. Put on some butter, and that. So you're going to eat some bread and some butter, some yogurt. That'd be a healthy way. And remember what I said about chicken, fish. It's the amount that you're eating. And yogurt is great. Milk is good. And turkey. And white rice seems to be okay to eat. So I would put that on the list. I've never eaten a lot of rice because it's sugar. The nation of India are rice eaters, but if you Google rice, it'll say no sugar. Well, it's a carbohydrate. It's 90% sugar. So oxalate is a molecule, a chemical molecule is found in plants and humans. And we begin to think that humans have more in them than the plants that we're eating. So how you control your own oxalates by maybe eating the yogurt or some cheese, some milk, so excrete it in the stool so it doesn't go to your kidneys. So it's not a required nutrient. You don't have to eat oxalate, okay? In plants, but it helps get rid of the extra calcium by binding with it. So to take in some calcium through milk or yogurt, it go out in the stool instead of being cleared by your kidneys where it can form stones. So oxalates in plants, why do they exist in the first place? It helps to get rid of extra calcium by binding with it. It's a defensive mechanism. Plants years ago defended themselves. Yeah, animals wanted to eat them. Bacteria wanted to destroy them, so they developed chemicals to defend themselves. And oxalates was one of the ways they defended themselves. This is through evolution, okay? Recent research indicates that calcium-rich foods a better approach to the oxalate problem. Remember, what type of food are you eating? My story, yogurt and cheese is what I'm eating now regularly for my breakfast, lunch. Remember, I go 2 meals a day. So that binds the oxalates before they go to the kidneys and decrease kidney stones. Wow, that's wonderful news, Dr. Kachmann. Thank you, Elam. So increase your water. Remember I talked about yogurt and cheese. Eat less oxalate foods. Remember spinach is full of them. Nuts is full of them. Don't eat those. So get a list so that you're consuming less oxalate foods. What is acylic acid? It's transparent. I'm looking at the chemical now. Colorless, crystallizes. Remember, if you have high oxalates in the urine, it can crystallize. And the chemical formula is HOOCOOH hyphen 2H2H. Man, that's complicated. I just want you to know that I know it. Okay. Discovered as many years ago, 1769, synthesized by a Swedish chemist, Carl Scheele, S-C-H-W-E-L-E. I'm just giving you a little history. You don't have to remember this. Okay, Dr. Kachmann, that's too much for me. And so actually, when they found out about this, this stopped the vitalistic theory of chemistry. Remember, they used to think that the chemical reactions were caused by the spirit of the universe, God, whatever you wish to call it, but they found out that's really not true. And too much oxalates in the stool or urine, if you have too much in the stool or urine, it goes to the kidneys, and that's myself too. I would go eat, and if I'm eating too much protein or too much of certain vegetables, didn't hydrate that day, I notice about 3-4 hours after I eat, I get a terrible belly pain. A terrible belly pain to the point I feel like I'm going to die. It lasts about an hour. I sit up, and then it seems to pass. And I think what it is, the foods are going down to my GI tract, and when they reach the colon, I'm having a reaction to the chemistry that hit the colon. It could be that the bacteria in my gut are attacking the oxalates or urate, whatever is entering, and trying to stop it from going to the kidneys. Because sometimes after that, a few hours later, I urinate, and it's a little blood clot and some bloody urine. The chemistry, I think, has increased, but I don't seem to have blocked or formed a stone. It's just a chemical reaction. But now that I'm hydrating, using a yogurt, some cheese, and watching what I'm consuming, I haven't had those pains. And remember, they occur 3 or 4 hours after I eat. It's a gut reaction to what I'm eating. And so by increasing that calcium, it seemed to form less chemicals in my urine, and I don't have the pain. I'm so happy you don't have the pain, Dr. Kachmann, because it's one of the worst pains there is. And so what increases oxalates? Food with a high intake of vitamin C. Antibiotics increase oxalates because it's destroying certain bacteria in your gut. Remember, you are what you eat. I am what I'm eating. Yes, Elon. And so what decreases oxalates? Remember, we spoke about the water being the one most important thing. Increase your water consumption. I'm not about sodas, I'm talking about water. And I'm doing it, and I'm doing it regular. Oh, good idea, Dr. Kachmann. I'm going to drink more water. Okay. And avoid eating too much animal protein. Remember we said that? Remember that I told you about that day that I ate a lot of animal protein, and I had a terrible pain in my belly, and next day my urine was a bit red, although I did not progress into the terrible pain back here like I had when I ate that Brazilian nut. So yogurt increases calcium, okay? Decrease sodium. Remember, salt affects calcium stores. So, but we need a certain amount of sodium, and it may be a little bit harder to regulate, but if you drink a lot of water, you're probably excreting quite a bit of sodium. And so what does protein do? Also, breaks down to a purine and makes uric acid. And remember, it makes acidic urine. You're more likely to have a uric acid stone, although that's only 10 to 15%. I still don't know whether I have oxalatic stones or uric acid stones. I'm getting in the mail a collector of my urine for 24 hours, and I'll know them. But I think I've refined my diet enough that no huge decision probably will be made after that. So purines increase uric acid, also increase urate, which increase oxalic acid stones. Also, purines increase glycine, which can lead to acidic stones. So it's important to know whether your urine is acidic or alkaline. Remember, citric acids, lemon, orange juice, decrease oxalic stones. Here's another one, methionine, decreases calcium in the urine. Oxalate, plants and humans both make it. Humans make it too, isn't that interesting? Yeah, and it's not just the plants. So when the University of Chicago is saying in their online course, which and a lot of information is good there, but I don't agree with. Eat all the meat you want. They're wrong. They're wrong because you can have uric acid stone. So across the board, oxalate restriction is no longer recommended. That's the science evolves. Science changes. We got to be willing to change. The teachers need to be willing to change. So most important of all, oxalate is actually produced by our body too. It's not just in plants. So your gut determines the oxalate absorption. And it's different among different people. That's the reason some people form more stones than others. But if you're diabetic, you're much more likely to have holes in your gut. And it has no time for the oxalate to combine with the calcium from the yogurt and go straight to the blood, straight to the kidney. So if you're having gut problems, you're much more likely to form stones. And what's interesting too, gastric bypass surgery, those patients have a much higher incidence of kidney stones. So if the incidence is 20-30%, what do you think their incidence is? So if you're going to have gastric bypass surgery, talk to your provider and see what he knows about it. He may not know a lot about it. I don't know. So gastric bypass increased oxalates. Remember, I said that. So what are the crystals in the urine? Remember, we talked about the crystals. They form stones, and they scratch the surfaces of the urine or the kidney and the bladder and cause some bleeding. So what are the crystals in the urine? Types of urine crystals. Uric acid ones. Remember, we spoke about that, eating a lot of meat. They're shaped like a barrel or like a plate or like a diamond. So if you're looking at a microscope, so like a barrel, a plate, or a diamond, they're brown or yellow. So look at your urine, okay? Calcium oxalates look like dumbbells if you look at the chemicals through a microscope. Electron microscope makes it even better, or like an envelope. We mentioned this before. So let's go review the symptoms a little bit of increased oxalates or uric acid or some other chemicals. There are other types of stones, but they're much rarer, and we don't have time to discuss them all. Constant need to urinate is one of the symptoms that you have crystals in there. Bloody urine is a clear indication of stones, and it can be very small, or it can be the size of a ping pong ball. Cloudy urine, foul-smelling urine, which I can appreciate. Nausea, vomiting. If you have an infection, you may run a fever. Okay, so what causes oxalate crystals? Let's review that again a little bit. One which can be that you're dehydrated and not enough urine. Remember my story of playing pickleball in tennis tournaments and not consuming enough water to begin with? And that, I think, is the most recent cause of my stone. Eating too much protein. I told you the story of myself and many people. They're just meat eaters, and they're much more likely to develop a uric acid stone, inflammatory bowel disease, dental disease. Is a big one because you could be having the bad bacteria over your teeth, and brushing your teeth every day, at least 2 or 3 times a day, and flossing is very important. Should start at a young age. You mean I should be brushing my teeth, Dr. Kachmann? Yes, Elon. You should be brushing your teeth every day. I noticed that you don't have any teeth. I'm sorry, Dr. Kachmann. I lost them. Maybe I was eating the wrong food. And teach children how to brush their teeth, starting at age, as soon as the permanent teeth, even before that, so they get in the habit of properly brushing and flossing their teeth. So what causes the oxalate crystals? Too little urine, remember I said dehydrated, or too much oxalate, and that's maybe there's not enough calcium that you're eating, like no yogurt, no milk. Dental disease, brush your teeth every day. Gastric bypass surgery, remember that, because you only have this little pouch here, and you don't have the normal GI tract. You're not consuming the proper amount of anti-kidney stone foods. Ask your surgeon about it if you're going to have a bypass surgery. I notice a lot of them are taking some of the drugs, inject their shoulder, and that's fine. But you got to follow a healthy diet too. Just injecting with a drug and you lose weight for a while, but you'll not be cured of your problem if you're not eating healthy food. That's very important. And diabetes are much more likely, diabetics, especially type 2, are much more likely to have kidney stones. Being overweight, more likely to have kidney stones, although you can be thin and be diabetic. The critical thing is to be sure you're not diabetic, not just to get a blood sugar or glucose tolerance test, get a serum insulin that is elevated 10 to 15 years, and changes are already occurring in your body, including vascular disease, kidney stones. Oh, you're not diabetic. I want to know what is your serum insulin. Then you will know whether you're diabetic or not. And in pregnancy, there's increased risk of kidney stones because women will get gestational diabetes, and it can affect the baby. So what is the treatment? Let's again go over the treatment once more. Increase the water. Okay, with that, we'll have a little drink here. I'm finally let it become a habit. I'm going to play pickleball tomorrow, and believe me, I take water along with me. Between matches, I drink water. I hydrate it beforehand and afterwards. If you can't control the stone thing, you can use Cardura, a blocker, Flomax. But again, I'm saying take a corrective action with the yogurt, cheese, eating low oxalate foods. Watch the portion of meat consumption. But Advil can be used for pain. Some people use external shock at the stone that breaks it up. It may pass without pain. Others need surgery. Some people need a catheter put in there and take the stone out. Many different ways to treat it, but see if you can't do what I'm doing and avoid that problem altogether. And so other things can you do to prevent it? How can you prevent osteocrystal? Well, like I said, drink extra fluids. Some doctors recommend that people who've had kidney stones drink 2.6 quarts of water each day. We discussed that. You got it, Elon? I got it, Dr. K. I'm going to drink a lot of water. That's the biggest thing. That prevents the majority of them. Limit the salt intake. A high sodium diet can increase the amount of calcium in the urine, which can help stones form. And watch your protein intake. Remember we said about the biggest thing there is to watch the portions and your experience, and find out what type of stone you got. Do you have a uric acid stone? That's 10-15% of stones, and maybe or an oxalate stone, which is 80%. So that's important. Too much of this nutrient can cause stones to form, the protein. Yeah. So it's okay to eat any meat because oxalates not in meat is wrong advice. Make protein less than 30% of your total daily calories. This book suggests Complete Guide to Low Oxalate Diet cookbook, but explains it, also has some recipes, and I encourage you maybe to look at that too, by Dr. Denise Finley, Finley. Probably can get it for $2 on Amazon. So these two books I showed you today, I think are good books. So cut down on foods that are high in oxalates. We talk about that, and make a list at home that you know not to eat spinach, chocolate, and rhubarb, soy, beets, nuts. When you do eat oxalate-rich foods, have them something containing calcium, like a glass of milk. So if that night you decide you're going to eat a piece of meat, maybe eat a yogurt before you go out or after you come home. This way, the oxalate will bind to calcium before it gets to your kidneys. It'll pass out in your stool. That's what I want to do, Dr. Kachmann. Yeah, I get the point. And so it's out of the stool before it gets to your kidneys, so it won't crystallize in your urine. So learn more about a low oxalate diet. I think I've mentioned these things enough times now that you begin to get it. But remember I said, I want you to read these books, look at YouTube, and don't accept just what is written. Get a few opinions, especially the one about potatoes. So what do we do now? If you had calcium oxalate stones in the past, which I have, or you have symptoms of stones, which at the moment I don't see a primary care doctor or urologist, but you get to know what is their knowledge. What is their knowledge base? Are they very knowledgeable? Let's face it, I went to a number of them, and they did not push at me or check up on me that I was drinking enough fluids. That should have been ingrained in my brain. Somehow it wasn't. Is it my fault? I'm not looking for a fault. I'm looking at a way to solve the problem. Okay. And so what food should I include? You're going to have some oxalates in foods, unavoidable. But if you do the other things, because the portions are reasonable, you may be okay. Graham crackers, egg noodles, pancakes, and waffles seem to be okay. All right? But if you're diabetic, eating a lot of sugary foods won't be that good. So some people have both problems. So you may need to have another look at that. Cooked and dry cereals without nuts or bran. So white or wild rice. Rice seems to be okay, best I can tell. If you're going to eat bread, white bread, remember I mentioned cornbread? I eat cornbread every day now. It tastes fine. And I add a little butter to it. And on this list, they seem to say English muffins are okay, but they're medium oxalate. I don't think I bother with muffins. And brown rice, spaghetti, and other noodles and pastas, medium oxalate. Remember I said the low, medium, and make a list. I don't know. And fruit that seems to be okay is apples, bananas, grapes, grapefruit, cranberries, peaches, papayas, melons. Now, they said strawberries okay, but then again, they read other sites and they'll say strawberries are not good for you. Okay. Remember, if you're going to have some fruit, eat some green grapes, like I do. And melons and pineapples seem to be okay. And vegetables, artichokes, asparagus, and Brussels sprouts. But I see people, asparagus, Brussels sprouts have some oxalates in them, so it's the amount. And they even recommend broccoli, but people who will list them as broccoli have an oxalates in them. Cauliflower, I think, is safe. Kale, cabbage is okay, but Romanian lettuce seems to be okay. But remember, spinach is high oxalate, is off the list. Cucumbers, peas, zucchini, mushrooms, and onions. Peppers, I think I would agree, generally safe. So, and here he's saying it's okay to eat potatoes and corn, but again, what I said, boiled potatoes seem to be okay, but baked potato is not okay. So it's conflicted information. Carrots, again, a small amount may be okay, but normally you don't eat that big amount anyway. And but green beans are medium oxalate. So again, it's the amount of oxalates. And dairy, I mentioned already, American cheese, cottage cheese, ricotta cheese, cheddar cheese seem to be okay. And what foods should you avoid? We discussed them already. Wheat bran, wheat germ, barley, grits, bran cereal, white corn flour, buckwheat flour, whole wheat bread. Then again, others will say rye bread is okay, but when I look at the sodium content, although we need some every day, I noticed a loaf I was reviewing today, and it was saying that it had a lot of sugar in it. Yeah, 15 grams of sugar. Man, that's like drinking a Coke. So be open-minded. So what am I telling you today? I'm encouraging you to that every case is a little bit different, that you would be open-minded. If you have secondary diseases like diabetes, or obesity, kidney disease, you've got to be more careful. Yet, read some books. This book is explanatory, but also has in it some recipes, okay? And then see what's going on with you. Maybe keep a log. I kept a log for a while, so I knew the amount of sugar I was consuming, but now it's a habit. We'll see. I've got to do this forever, or I will have another stone. If I have a vision of that, I think I'm much more likely to be motivated. Are you motivated now? Yes, Dr. Kachmann, you really brought the information down to me. I now fully understand it. Okay. And lastly, no more kidney stones. There's a great book to read. So I want you to gather a lot of information, and then you'll be on the path. But 90% of kidney stones can be prevented. Let's get to work. Let's form a team. Let's put our arms around these kidney stones and throw them away. Thanks for watching the show. This will be on YouTube in 10 days, so you can watch it again and read some of the books, go online, gather information. And Elon, I don't want you and the people out there to ever have a kidney stone. Thank you for speaking to us today, Dr. Kachmann. Tell me all about it. I now understand, and I'm not going to have a kidney stone, and I hope you never have one either. Thanks a lot for watching. Enjoyed talking to you. go to YouTube, you'll find probably 1,000 other shows on health to increase your knowledge, and you'll live to be 100 and play pickleball with me. I want to play you too, Dr. Kachmann. Thanks.